High blood pressure is a common presentation in the emergency department, and understanding how to evaluate and manage these cases are essential for optimizing the outcome of those patients. Today, I want to talk about clinical approach to asymptomatic hypertensive patient in the emergency department. Without further discussion, let's jump into our presentation. My name is Dr.Moallim. I'm one of the doctors in the emergency department, and I have the Jordanian Board of Emergency Medicine and Royal College of Emergency Medicine. And in my channel here, I want to talk about some topic that related to the emergency medicine. And today I pick up this one because I found a lot of doctors in the hospital setting, they became panicked when they dealing with the patient with high blood pressure. So they are dealing with the patient like the numbers. So if the patient presented with very high blood pressure, like 180 over 120, they become panic and they want aggressively to treat those type of patients. That's why I create this title, which is the clinical approach to asymptomatic hypertension. So I'm not talking here about the patient who has a high blood pressure and stroke or high blood pressure and MI. I'm talking here about the patient came to the ED with high blood pressure, but he doesn't have any symptoms. How to deal with this type of patients, how to investigate, and how to address their high blood pressure. So before we start to some talk and to discuss the details, I need to start with the case scenario. So our case scenario here, it's a 65 years old male patient, and this patient came to the emergency department due to the hypertension. But the patient, he was sent to the ED by his dentist. So this is the main things here. We have to know the patient, he didn't came because of the high blood pressure. He doesn't know he had the blood pressure is elevated, but this patient was visiting the dentist for the dental issue. And the dentist discovered that his blood pressure was 180 over 105. Then they send the patient to the ED. Definitely the ED doctor or any doctor in the hospital, he should start to ask some questions like the patient has a chest pain or not, okay, if there is any shortness of breath or not, if there is any headache or not, if there is any vision changes or change in the urine output. So to summarize the case scenario, we have a patient, male patient, 65 years old, came to the ED because of high blood pressure, but the ED, the emergency department, was not the main area to visit. He was in the dental clinic, and the dentist sent the patient to the ED because of high blood pressure, 180 over 105. You ask the patient about the chest pain, shortness of breath, headache, and vision changes, and the change in urine output. And all of the questions were negative. I mean, there is no adverse signs in this patient. So, how we will approach this patient, how you can treat this patient, this is my question. So think in a moment, high blood pressure patient came from the dental clinic and there is no signs, no chest pain, no shortness of breath, nothing there. You would treat him with antihypertensive medication. You will start to do some investigation, blood workup, ECG, what you have to do in this case. This is our talk today. So first of all, let's talk about the hypertension in numbers. So normal blood pressure category, this is the guidelines from the American Heart Association 2017. They said the high blood pressure, it's usually the number one is started to get elevated after 129 in systolic and above the 80 in diastolic. And there is a clear cut here. If there is a stage 1, the number will be almost 130. And if this is stage 2, the number is clear cut in 140 systolic and diastolic already 90. And here the magic number, the hypertensive crisis, and all of the people, they became panic when they saw blood pressure 180 over 120. So you have a patient, and I think our patient is under this category, hypertensive crisis, but still the question is valid. Do you want to treat this patient or you want to investigate this patient? So, first of all, let's talk about the general perspective about the hypertension. Hypertension is a long-term problem. It rarely can come like the immediate problems. But if you have a patient with high blood pressure, and if you have a patient with a history of hypertension for more than 5 to 10 years, and this patient is not controlling his blood pressure, definitely he will get sick, and he can present it to the ED with one of the complications like congestive heart failure, like the coronary artery disease, stroke, and renal failure. So patient can present with a real problems like the mortality case, or he can present with a serious complication like the pulmonary edema, massive hemorrhage, stroke, renal failure, but after the long term of uncontrolled hypertension. So now we have our patient, and our patient is under category of hypertensive urgency. But the question is the hypertensive urgency is a real thing? This is we should know about that. What is the hypertensive urgency? That's mean there is a high blood pressure. The number we mentioned before, it's the high blood pressure of 180 and the diastolic 120, but there is no end organ damage. This is definition of hypertensive urgency. But there is a debate if this hypertensive urgency is a real thing or not. The Royal College of, American College of Emergency Physicians, they said there is a term for hypertensive urgency, better than hypertensive urgency. It's asymptomatic, markedly elevated blood pressure. And they said this is not a real thing, so you have to put your focus and concentration to identify if the patient has an end organ damage or not. So you have to focus about the signs of end organ damage. If you want to do investigation, put all of the effort to identify the end organ damage. It's not based on the number, so please, 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 as a junior doctor, don't focus about the number, focus about the approach to help the patient. Okay, so let's move to the next step, which is the treating the patient of hypertension in the ED. Either will be hypertensive emergency or will be the hypertensive urgency. So what's the definition of hypertensive emergency? High blood pressure of category more than 180 over 120 plus end organ damage. What is the end organ damage, Dr. Moallim? We will learn about that in the next slide. If the patient has high blood pressure without end organ damage, will be under category of hypertensive urgency, which is the markedly elevated blood pressure and asymptomatic patient. I hope this slide is really clear, and I hope this slide to be clear for you guys, because this is the foundation of our lecture. Okay, so we came to the most important slide, which is what's the end organ damage. So you have your patient. We said that our patient, 65 years old, came to the ED, sent from the dental clinic, and the patient has high blood pressure. First of all, you will ask about the end organ damage. Definitely the nurse took the vital signs and the blood pressure 180 over 120. So you will ask about the central nervous system symptoms. Just definitely you will ask about the nausea, vomiting, and the headache. Basically, if there is nausea and vomiting and the headache, that means the patient maybe have some sort of issue of stroke, or ischemic stroke, or hemorrhagic stroke, or encephalopathy. And on the other hand, we are coming from up to down. Here we are looking for the eyes right now. Ask the patient if there is any vision changes, like the blurring of vision, loss of vision, any abnormal things in the eyes. That means maybe we have some sort of high blood pressure plus acute retinopathy. And the heart is an easy way to ask if there is any chest pain, any shortness of breath. You can get the ECG, you can do the chest X-ray, you can look for the evidence of heart failure, and you can look for the evidence of acute myocardial infarction, which basically will be clear on the ECG, or unstable angina. You have to run some tests like the troponin. And in the kidney, you have to ask about the urine output, and you have to ask about if there is any change of the urine color like the hematuria. And definitely you need to request the creatinine, and you have to compare this creatinine result with the previous creatinine result to understand if there is any changes and if there is any end organ damage. Definitely, if the blood pressure is getting high, is affecting the blood vessels, and the pressure inside of the vessels when it gets high or elevated, definitely the patient can develop the aortic dissection or aortic rupture in case of what we the major blood vessels in our system. And also the high blood pressure can affect the pregnancy, so patient can develop preeclampsia or eclampsia in case of, and also the HELLP syndrome and thrombocytopenia. So this is the end organ damage. In summary, we need to ask about the CNS symptoms: nausea, vomiting, headache. We need to ask about if there is any changes in the vision. We need to ask about if there is any problem in the chest pain or shortness of breath, and if there is any changes in the urine output, or if there is any changes in the color of the urine. And definitely you have to look for the evidence of aortic dissection and eclampsia. So after we discuss about the end organ damage, so according to the American College of Emergency Physicians 2013, there was a question, and this question for me, it's really important question for the ED physician and for any doctor who work in the clinical setting. So should I routinely perform a test to assess the end organ damage? As we said, our patient came from the dental clinic with high blood pressure, and you examined the patient, no end organ damage from the symptoms wise. Now, do you want to perform the test? So to be honest, the answer came in general no, but if you want to do, you can do just only the creatinine. And here for myself, usually what I'm doing in the ED, if he came with the history of high blood pressure, I can do the ECG to look for the long-standing hypertension signs, which is left ventricular hypertrophy. That means the patient needs to control his blood pressure, otherwise this can be deteriorated later. And I can request the serum creatinine, and it will give me the idea about, you know, the hypertensive nephropathy. And I can add also the urine. I can add what you call the urine to look for the protein, and that's really the market signs for the nephropathy. The other question came 2013, should I treat the asymptomatic hypertension patient in the ED? In general, the answer is no. But if you are so worried to discharge those patients, you can give the patient some sort of antihypertensive medication, and definitely you will arrange a follow-up with the GP doctor or the outpatient clinic. So they will, according to the type of the health system in your country. But I believe that you don't have to start aggressive treatment. We are not talking here about the IV medication, but we are talking about you can start some oral medications, and we will talk about that later. And the other question came about what the utility of the lab test for the asymptomatic hypertension. They did a study and they found if the doctors they started to request the blood test for those patients, only 5 to 7% came positive or abnormal test. But most of the tests were negative, and only they are reflecting the chronic stage of high blood pressure. So the answer is there is no benefit to request a lot of tests. As I mentioned before, for myself, I just focus on the ECG, looking for the left ventricular hypertrophy. For that mean the uncontrolled hypertension, long-standing. And in this case, we can educate the patient, we can send them for the follow-up. And the second thing, looking for the urine protein and also the creatinine. Those are the major tests I can do in the ED. Other than that, it's just only it's utilizing the resources. And the question for the most of the doctors, if you discharge the patient with the number of 180 over 120, does the patient can develop some adverse event? Actually, they did study the extreme low rate of adverse event at the 30 days. So you will discharge the patient in a small dose of antihypertensive medication, and you will ask the patient to have a follow-up. And also in addition to that, you will give him an advice to reduce the salt, encourage the oral intake, and do some exercise. All of those kind of things will help the patient, but the outcome appears similar to the other patient without hypertension. So nothing to worry in this case. And this is a slide from the up-to-date, and up-to-date they define the severe hypertension like the 180 systolic and 120. We mentioned that, and they said if you want to control the blood pressure, so usually we suggesting to the lower blood pressure over periods of hours rather than longer period of time. So I mean, rapidly controlling the blood pressure really can cause some adverse event like stroke and myocardial infarction. So as we mentioned, you have to look for the end organ damage. What I'm doing in the ED basically is taking the patient to the quiet room and dark room, address the pain, address the anxiety, and recheck the blood pressure after 30 minutes. And really it's helping the patient in this case. If you want to start antihypertensive medication and you are really worried about that and the patient is anxious, you can start in this setting thiazide diuretics or calcium channel blocker as a first line. If the patient has comorbidity like the diabetes, heart failure, history of previous MI, whatever, you can give the patient angiotensin converting enzyme inhibitor or ARBs. And this case really will help the patient. And take a breath, we're almost done, and I know I was talking too much in this topic, but really it's an important topic for the junior doctor. Our message is, if you have the patient came to the ED, in the door of the ED with the history of high blood pressure, and you check the vital signs, blood pressure is in the category of 180 over 120, you have to take a breath and think about the approach. Is a hypertensive emergency or hypertensive urgency? And how do you know the hypertensive emergency? There is an end organ damage. And what's the end organ damage in this case? It's the CNS, eyes, the heart, and the kidney, and the blood vessels. I hope this lecture was very clear and the message was so clear for the junior doctors and for anyone who is interested to treat the asymptomatic hypertension. If you like the video, please like or subscribe and tell me in the comment if you like the content or if you want any other lectures in the future. I would be so happy to address that. Thank you so much. Take care for yourself and for your family. Bye bye. Assalamu alaikum.